songs was way back for those who are, I don't see hardly anybody in my grouping, that would know Bobby McFerrin and Don't Worry, Be Happy. And maybe you heard it on some kids' show when you were growing up. And then you may be more familiar with Pharrell Williams, his song Happy, okay? And when you hear those songs, you can't help but to smile. It changes your mood by just being that. And interestingly, both songs say, if you make the choice, if you decide to be happy, okay? So we make the decision whether we're going to be happy in the morning, or whether we're going to be sad, whether we're going to be mad, or we're still going to be mad at our sister, our brother who did something 4 years ago. It's a choice to be mad. It's a choice to be happy. We have to make that happen. And last, if you want to try a little experiment while you're in the room, since we're scientists, there's a thing called smile therapy. Okay? And we often talk about, I'm just not fake. I'm not going to work and smile at those people if I don't feel like smiling. Well, studies show that a fake smile can actually change your mood and make you happier. So if you take it, as the woman here in the picture is showing, you take a pencil and you put it between your teeth so that your lips won't touch. It forces you to smile. If you hold that for about 5 minutes, it will change your mood and you actually start smiling. Okay, so the next time you're around people and you do that, just hold it a little bit longer and that smile will turn into a real smile. Okay, so we see that the mind has some real powers and it makes some decisions of what we can do, what we can't do, and you can influence your patients as you're working with them. If you're interning, if you're doing some volunteer work right now, you can tell them, hey, you're going to have a great day. Let's say that we're going to have a great day today. And the person will look at you really weird, right? Okay, when you stay at them, and if you keep making those suggestions, the power of suggestions can change what they're thinking. Okay? So what we're going to do now is change the table just a little bit and move away from you looking at the patient and interacting with the patient and talk about some real concerns for you as the healthcare professional. Okay? Although I'm not a physician, I saw myself in many of these things as a faculty member working with students, working in a research lab and dealing with different issues. Some of the same issues came up, and it comes across the board for many professionals. One of the major for professionals, and particularly even more so in the healthcare field, would be burnout. And so we want to talk about what is burnout. How many people heard of burnout? You hear that all the time. Okay, great. And you may be experiencing that. We're coming towards the end of the semester, finals are approaching, and this semester went like that, it seems like, right? So we're trying to figure out how we're going to get all these papers done, how are we going to complete the syllabus, and there's this next exam coming up that I should be studying for, but I'm at the conference and right? So we're experiencing that stress. So what is burnout? So burnout is a work-related syndrome. So it's a syndrome. It's not something that's just, that's a word that we're throwing around. Okay, so it's a real condition, a syndrome involving emotional exhaustion, depersonalization, and a sense of reduced personal accomplishment. So we'll take a look at each one of those. What do we mean by emotional exhaustion? At the end of the day, end of the semester, or whatever the case may be, usually it's the end of the day, you just feel all used up. I don't have any more to give. I'm going home, I'm going to take my shoes off, I don't want anybody to call my name. If I hear Dr. Crayton one more time, I'm going to scream, right? Or, and your poor kids, if you have, for those who are parents in the house, like, leave me alone for like 10 minutes until I adjust, right? So you just feel exhausted, you're drained, and you don't have the energy to do anything else. So you may experience that. You just got out of the lab, it's late, the experiment didn't go like you want, and you get back to your room, and your roommate, who's not a science major, wants to chat about what's going on and their new boyfriend or what happened on Snapchat or whatever. And you're like, look, just chill, right? Okay, so I don't have anything else to give. Depersonalization. It's when particularly among physicians, is when the patient becomes more of an object, or you try to treat them more as an object as compared to a real person. So you've kind of distanced yourself from them, and it's like, okay, lady, I've heard 20 people today talk about pain and that they had to have the Percocet. Okay, so I'm just worn out. I'm burnt out with it. I can't hear it again. Okay, and so of course that then starts to relate to patient care, and then the patient is frustrated, like, oh, you're not going to talk to me like that. Right? I'm gonna get my mom and my cousin and everybody else. So that depersonalization then becomes a problem in the workplace. And then a sense of reduced personal accomplishment. Am I really helping someone? Or you become frustrated where it's that diabetic patient and you talk to them till you were blue in the face about stop eating those things that you're not supposed to be eating, and they come back and they still are eating those, and they've gained some more weight, and their sugar levels are just off the roof, or you ask them to take their meds. Well, did you take them? Oh, no, I didn't like the way you did this or did that. And it's like, well, my hands are tied. If you're not going to follow the instructions that I'm giving you, I can't help you, right? And so you have that sense of reduced personal accomplishment. Am I helping anybody? Am I doing anything? Are people seeing my effort? Or do they realize how much time I'm giving and the sacrifices I'm making? Okay? So these things lead to burnout for the physician. Okay? Now, burnout is distinct and different from job dissatisfaction. Okay? I went to med school, I have all these loans, I don't really like this, but I'm stuck, so I just gotta do it, right? So sometimes we have that, or I don't like this particular setting. I'm at a rural hospital because I want to break on the student loans, but I really want to get back to the city and work there, or I'm at a public hospital, I want to get a private hospital, or I want to go into private practice. There's job dissatisfaction. Fatigue. You guys don't get tired, right? The long hours studying, and that began as an undergrad for those who were pre-med majors, right? My students complain all the time, but I had to study this many hours. Like, yeah, I did too when I was in an undergrad as well. You're going to keep on studying. If you think this is something, just go to med school and see how many more hours you have to study. Okay? So we have fatigue, and then you're intern, and then you're a physician, and you're on call, and it seems never ending, and you're just physically tired. Okay? And when you combine that physical fatigue with that emotional exhaustion, it's like, please give me a break. Okay? Occupational stressors. Of course, somebody's life is in your hands every day. For me, I'm like, okay, I just got to teach class. And therefore, it's not as stressful. But when you know someone's life is on the line, and then based upon all of those things, it could lead to depression on the part of the physician. So although burnout correlates to many of these, the burnout can be present when the others are present, or the others can be present when burnout is absent. Okay. So why is physician burnout important? For three major categories: patient care. With this fatigue, with the burnout, of course, there will be a lower quality of care, which means if you're tired and fatigued, there may be more medical errors. Longer recovery times, lower patient satisfaction because you're just not feeling it, right? And they pick up on that. Next, physician's health. So to get through it, like Nurse Jackie, start popping some pills, in a TV show. Or there's substance abuse that may occur to try to keep you awake. The depression and the feeling of dissatisfaction, it may lead to suicidal thoughts and deep depressions. Poor self-care. I don't have time to shower. I got to get there. I've been on my feet for 23 hours and I did a shower and a shave is just not in the picture right now. So poor care, and then that can lead to other issues. Okay? And then fatigue, motor vehicle crashes. When you do get a chance to go home, you're so tired you fall asleep at will. So there are different issues affecting the physician directly. Others, the healthcare system, if the physician is compromised, of course, all the quality of care is compromised as well. Some staggering things, and I'll say, oh, can I show you this as I go forth? They're not going to ever want to talk to me again. But statistics are showing that there's some grim statistics for both medical students and physicians. 15 to 30% of medical students and residents screen positive for depression symptoms. 54% of physicians are affected by burnout. That's almost half. 37.9, almost 40% of physicians experience emotional exhaustion. And about 30% of medical trainees experience depersonalization. Gets worse for women, unfortunately, ladies. Okay? So nearly half of female physicians believe that they have experienced symptoms of depression. So compounded with everything else, then there's that biological clock that you have to think about also, right? And you're, approaching 30 or 30, and you're like, okay, I want kids, I want a family life, and so that can lead to other things. A staggering number, which shocked me as I was looking up, physicians have the highest rate of suicide among all professional individuals. And so we do have scientists down there on the end as well, so I'm not escaping, and our dentists are in there second. So the amount of stress, and these are the things that contribute to those levels of stress. One, talk about the paperwork for those of you who are physicians and have to do it on the computer, and you're doing the complete write-up of the visit, and you spend time on the computer doing that. The cost of care, dealing with insurance, the medications, dealing with patients themselves, the weighing costs on you for student loans, and you have this debt that you're coming out of school with. So all of those factors are compounding upon the physician to lead to those things. But we do want to leave on somewhat of a good note and say that there are things that we can do. Okay? So one of the things you want to do, you can consider your career path. If you want the traditional path, or if you want to do something different and to be a celebrity doctor, or you want to be the doctor on the news who talks about you should get your flu shot, and or you can be someone who goes around speaking and doing different things as compared to the traditional schedule. Okay? Your specialty area, are you in the right area? Did you specialize, or are you general practice, or should you be doing something a little bit different? The type of practice, do you need a private practice? Do you want to be on call? Do you want to be a dermatologist and you just set your own hours and and do that type of thing, and nobody calls you in the middle of the night, and you don't have to miss the birthday party and your dance recitals of your kids and that kind of thing. So consider those. But most of all, we want to take some reflection time to enjoy nature, to enjoy our families, our friends. And one thing I would encourage, and I did as a graduate student, as I was working through my Ph.D., the thing would be like, when I finish my degree, I'm going to do X, Y, and Z. And my recommendation to you, and someone said it to me, and I tried it, is live for today. Okay? So don't put off living until you get your degree. Take some time to enjoy your family. Don't totally isolate yourself, because that becomes our tendency. We're workaholics, and we're staying those books and staying those books. Find a friend who will pull you away from a book and take you to a movie, or take you to a park, or do something to free your mind to get rid of that depression. Okay? So we close with this one. Let us not be weary in well-doing, for in due season we shall reap if we faint not. We are helping people, you are helping people, and helping people gets tiring, and sometimes you get burnout, but if we stick to it, we will get the rewards for our personal satisfaction in our life. We do have to remember to take the time to smell the roses, to enjoy life. Tomorrow is not promised. And when closing is, I had a really outstanding student at Xavier. Her name was Danielle, and she was living with lupus. This was some years ago. She got into med school at Howard University, and within her first year of med school, she succumbed to the lupus, and she passed in her first year of med school. And it's the resounding message that we never know how long we have. And we should take some time to make sure that we are spending time with our friends and family and relatives and enjoying ourselves in our lives. Great. I'll close by just inviting you this afternoon. I know you'll still be here, but if you know people in the city who might be free, I'm going to be going up to the Shreve Library, North Shreveport branch at 4 o'clock today, and I'll be doing a discussion of my book, Brain, Mind, Soul, and Spirit. Some of the things that we talked about today are, well, most of it is in the book, but I actually do readings from the book, and then each chapter has 2 discussion questions, and then we engage in a discussion and we get feedback from the audience. It's usually an awesome time. So if you have a chance to come, The library closes at 6, so we'll have to be out of there on time. Okay. So I just want to let you know that. And if you're interested, my book is on barnesandnobles.com, amazon.com. My website is there, Crayton Services LLC. And if you purchase it there, then I'll autograph it and mail it off to you. Okay. So thank you again for having me here. And I don't know if there are time for questions. If so, I will take a question or two. No?
It's 2 minutes till
Okay.
2:30.
No. All right.
So no.
Thank you.